My name is Jennifer Husnick. I am a licensed massage therapist. Been working in the field of massage for about 25 years now. I guess in 20, the 25 years I've been doing massage, I have been working about most of the years, except for the first 2 years, I've been working with doctors and doctors' offices. So the type of massage that I do is a little more medical, not so much spa, fluffy kind of massage, which is also very nice. But my type of massage is more specific to injuries, pain management, which also helps to relax the person, de-stress, and boost your immune system. So that is very important for this time, specifically with all the things that are happening, viruses and things like that. Boosting your immune system, keeping healthy, keeping de-stressed. It all goes with the massage therapy. Because touch actually releases pain relieving endorphins throughout your body. That is very helpful in relieving pain. Just knowing somebody is caring for you, knows what they're doing, and the intent that we have as a massage therapist is to help you feel better. Sometimes that goes a long way. Also, when we're working on certain muscle groups that are in spasm or causing pain, just bringing that blood flow to the surface, pushing out all the metabolic waste and toxins that are stuck in the muscle to help release all of that, that helps the pain as well. It can be a little bit uncomfortable at times, but we always say it's kind of the good pain. And that's how we know we're working on an area that really needs it. So day to day, headaches, or I slept wrong and I can't turn my neck, that kind of thing. Very good for specific injuries like that. Because I work in a chiropractor's office, we work on a lot of chronic pain as well. So getting massage on a regular basis can help people who have like chronic issues with their lower back, maybe their muscles are weak, and so other muscle groups have to tighten to counteract the weak areas. So we work on the other muscles, get them to loosen up, and everything kind of goes back to where it should be. So it helps in, any which way, chronic or acute injuries. A lot of the patients, that's their number one question: when am I going to feel better? Everybody's very different in how their body receives and reacts to massage. So most of the time, there's some slight difference right away. And again, I think that's because of the endorphins that touch it, getting touched, and that caring for somebody, they're feeling that, and that's a big part of healing. But then as they, some people, their muscles are very, very tight for a very long amount of time. And I always say they're kind of like a stubborn, naughty 3-year-old. They don't listen sometimes, the muscles. So you have to keep going consecutively to get it worked on. So you relax the muscle, it kind of listens, and then it might just tighten up again and say, we're not going to listen to this therapist. And then you go back in, you get it worked on again. Everybody's slightly different in what their body can handle as well. Like the deep tissue, not everybody can handle deep tissue, and you have to kind of go with what your patient or client can handle. There's some people I want to just get in there and just work on those spasms, but immediately I can tell their muscle tissue just tightens right up. So I need to back off and just go easy, easy, easy. So, but most people can feel some type of difference early on in their massages. You would want to look for somebody, obviously, who has a license. In the state of New Jersey, it is required now. States differ, everything is different depending on what state you're living in. I would also look for somebody, well, it depends on what kind of massage you want too. There's so many different kinds. You know, if you're looking for a very relaxing spa massage, they still have to be licensed in a spa. You know, you can go that route. If you're looking for something specific to an injury, rehab, or something like that, you'd want to go ask a physical therapist. They might know. I have a couple of physical therapists that will refer their patients to me for massage. Ask a chiropractor. Um, like I said, I've always worked with chiropractors, and I've actually worked with a group of neurosurgeons. You can always ask around, you know, your other medical professionals where they would want to send you. We found in our office that there are some insurance plans that will cover, I believe, like a 30-minute session, as long as they're getting an adjustment with it. It's considered trigger point therapy. Most insurances do not cover massage, unfortunately. I think it's because insurance companies can't really keep track of where the person's going to get the massage. There's no like big database of like, okay, all these therapists, you know, you could take your script and go and get it covered. I also think it's kind of a blessing that they're not paying for it, because once insurance companies start to pay for things, they start to dictate what you can do and what you can't do. And, you know, massage is so specific to the person giving it that it's hard to say, well, you can't, you know, the insurance company says I can only work on this trigger point for X amount of minutes, and then I have to go somewhere else, or I have to do, you know, something different. So we as massage therapists have our own style and technique, what works best. And I think insurance companies might end up trying to dictate a little bit more what we can do.
Thanks so much for joining us today. For more information, please email us at cicseniореducation@gmail.com. We'd be happy to answer any questions you may have and provide additional resources. Be well and stay safe.